Yes, I feel the same way, actually. All right. We do have a letter we want to read. This is something we think is very special, and Pat Moore is going to have an opportunity to read it. It is from... Pat, who's it from? Janet Bradbury.
And Marvin Ross.
And Marvin Ross. She's going to read this letter.
This letter, how many of you remember Janet Bradbury? Yeah. Well, Janet's still fighting for things. She couldn't be with us today, so she sent this email. Dear friends, thank you for your commitment to a national health plan for the U.S. We are fighting to get what we should have had for 60 years. I suspect that all of you there helped elect someone who now lives in Washington, D.C., and we need to pressure them to get this in the law. It would be a disgrace if an idea whose time is long overdue was not passed with a Democrat majority in Congress and a Democrat in the White House. Keep the faith and remind the old folks who are so against socialized medicine that they love their Medicare, don't they?
Yeah. Yes, we do.
I also have a letter from Marvin Ross. He's addressing his personal health care issues. Much like Carol, he has very high drugs that he and his wife have to use. My wife and I are seniors in the mid-70s with multiple health issues. In 1993, I, Marvin, was approved by the Social Security Administration for orthopedic disability benefits. This led to Medicare coverage effective March of 1995. Although the Medicare coverage is Can you hear?
Yeah.
Okay. Now I lost my place. Although the Medicare coverage is rather limited in scope, we have appreciated the low administrative costs for Medicare benefits. However, the private insurance companies have increased their Medicare supplement premiums to an unaffordable level, which is a major problem for us and for all of us on Medicare. We believe Congress should initiate a single-payer health care system by expanding an improved Medicare law to cover all U.S. residents.
Single payer now!
We support H.R. 676, yes, which would cover every person for all necessary medical needs, including prescription drugs. Since I am on 7 prescriptions daily, I have chosen to elaborate on my experience with the Medicare Part D law. On March 15, 2008, the full discounted price of Lotrinex, 1 milligram, number 30, was $369.13 at Target Pharmacy. How many of us can afford that every month? On January 2nd, 2009, just 10 months later, the very same Lotrinex prescription had increased by cost by $63.55 to $432.68. This represented an increase of 17.22%. Local pharmacy officials blame the increase on drug manufacturer GlaxoSmithKline. In another of my prescriptions, Altrapev, 60 milligrams, number 30, within a 10-month period, the cost increased from $95.41 to $104.59, an increase of 9.62%. The Part D increasing the initial coverage limit for 2009 from $2,510 to $2,700 served as no more than a minor challenge to the drug manufacturers and insurance companies as they simply increase the drug costs for seniors, as noted above, as well as monthly insurance premiums. For our family, based on current prescriptions, the prescription coverage that our government has committed millions to is of minimal value. Conversely, the Part D plan is greatly enriching the coffers of the drug and insurance companies at our expense. Prescription coverage for seniors needs to be incorporated in the single-payer health plan for Congress.
Yeah.
Yesterday, a beloved friend buried her son. Here's Forrest's picture, Tiki Rogers. Many people in this audience know Bertha Rogers and love her very much. This young man was 58 when he died. He had diabetes and has been suffering from health problems for a long time. Had lost a job, no health care, and did not attempt to go to a doctor. At one of our healthcare meetings, his mother talked to Nancy Schinkel from Matthew 25. Fidi was in the hospital and had 4 dialysis treatments. The doctors told her that he was fine, he could go home, call Matthew 25 on Monday. In the meantime, he passed away. So for all those people out there marching who think that these are just no stories and they're just... Pardon? So for all of you, please remember Bertha in your prayers, and for her son, another healthcare debacle. Thank you.